Welcome to Module 6 of the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test training series. In this final module, we will thoroughly cover the essential safety protocols, quality control measures and best practices necessary for conducting the test accurately and safely. Ensuring these practices are followed correctly will help maintain the reliability of your results and protect everyone involved in the testing process. Let's explore these critical aspects in detail. Safety is a fundamental priority when conducting any diagnostic test, including the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. Although the test components are non-infectious, handling blood samples always carries a risk of exposure to bloodborne pathogens. Therefore, it is crucial to adhere to established safety protocols throughout the testing process. To start, always wear gloves when handling any test materials or samples. Gloves act as a primary barrier between you and potential contaminants. Before beginning the test, ensure your gloves are intact and free from tears. If your gloves become compromised at any point, replace them immediately to maintain a sterile working environment. Follow universal precautions, a set of guidelines designed to prevent the transmission of bloodborne pathogens in healthcare settings. These include, but are not limited to, safe handling and disposal of sharps, the use of gloves, proper hand hygiene before and after removing gloves, and wearing additional protective clothing, such as a lab coat or gown, as required by your facility's protocols. In the event of a spill involving any of the test solutions, clean the affected area immediately with plenty of water. For spills on skin or clothing, wash the area thoroughly with soap and water to remove any potential contaminants. Following these procedures helps ensure your safety and the safety of others in the testing environment. Quality control is an integral component of the testing process, ensuring that each test is valid and produces accurate results. The INSTI Multiplex test is equipped with built-in controls, but additional quality control measures are necessary to uphold the highest standards of testing. The INSTI Multiplex test features a built-in procedural control indicated by the appearance of a blue control dot on the membrane. This dot confirms that the test has been run correctly and that the sample was properly applied. If the control dot does not appear, the test is invalid and you must repeat the test with a new kit. In addition to the built-in controls, external control samples specifically for HIV and syphilis are available for use. These controls should be employed under specific conditions, such as verifying new operators before they perform testing on patient samples, when switching to a new lot number or test kits, upon receiving a new shipment of test kits, or when storage or test conditions fall outside the recommended temperature range of 15 to 30 degrees Celsius, which is 59 to 86 degrees Fahrenheit, or at regular intervals as part of your facility's routine quality assurance program. Using these control samples helps verify the performance of the test and ensures the accuracy of results, particularly under changing or challenging conditions. Be sure to follow the specific instructions for use provided with the control samples to maintain consistency in your quality control procedures. Remember, it is not recommended to use external controls that have not been validated for the INSTI Multiplex test, as these may not produce the expected results and could compromise the reliability of your testing process. Implementing best practices is essential for ensuring the consistent performance of the INSTI Multiplex test. Adhering to these practices will help maintain the quality and reliability of your results. Here are some key best practices to follow. Proper storage of test kits and controls. Store the test kits at 15 to 30 degrees Celsius, which is 59 to 86 degrees Fahrenheit, and ensure that control samples for HIV and syphilis are refrigerated at 2 to 8 degrees Celsius, which is 36 to 46 degrees Fahrenheit. Avoid exposing these kits and controls to extreme temperatures or direct sunlight, which can degrade their effectiveness. If kits or controls have been stored outside of these recommended ranges, do not use them, as this can affect the test results. Handling test components correctly. Use each component of the test as intended. The capillary pipette included in the test kit is specifically designed for collecting fingerstick blood samples and should not be interchanged with other pipettes. For control samples, use a calibrated 50 microliter pipette to ensure accurate volume addition to the sample diluent vial. Adding too much or too little sample can lead to inaccurate results. Ensuring proper sample collection. Collect the correct amount of blood and transfer it to the solution 1 vial immediately without delay to prevent clotting. Follow the instructions precisely and always perform steps in the correct sequence. Inadequate or excessive sample volume can significantly impact the accuracy of the test. Performing test steps in the correct sequence and timing. It is essential to adhere to the correct sequence of steps and timing as outlined in the test procedure. Mix the solution 1 specimen mixture thoroughly before adding it to the membrane, and proceed to add the solution 2 and solution 3 in order. Read and interpret the results immediately while the membrane is still wet. Do not read the results if more than 5 minutes have passed after the addition of solution 3. Safe disposal of used components. Dispose of all used test components, including lancets, pipettes, gloves, and the membrane unit, in designated biohazard containers. Proper disposal is not only a safety measure, but also a regulatory requirement to prevent environmental contamination and maintain a safe working space for all staff. Following these best practices ensures that every test you perform is as accurate and reliable as possible, contributing to the overall quality and effectiveness of your testing process. In summary, safety, quality control, and adherence to best practices are the cornerstones of conducting the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. By following these safety protocols, using appropriate quality control measures, and implementing the best practices discussed, you will ensure the accuracy, reliability, and safety of your testing procedures. Always remember to store your kits and controls properly, handle all components with care, follow the exact testing sequence, and dispose of your used materials responsibly. Thank you for your dedication to learning and mastering the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. Your commitment to maintaining high standards in testing ensures that patients receive the most reliable results possible. With this knowledge, you're well equipped to perform the test safely, accurately, and confidently. This concludes our training series. We hope you've found this course comprehensive and informative. Remember, the skills and knowledge you've gained here will play a crucial role in your day-to-day work, contributing to better patient outcomes and overall healthcare quality. If you ever have questions or need further assistance, please refer to your training materials or contact bioLytical Laboratories Customer Support. Thank you for completing the training on the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. Best of luck in your testing and keep up the great work.